Good morning. First of all, I would like to thank Shire for inviting me and you for attending here. I would like, this is my disclosures. I'm going to speak about the non-haematological perspective in the diagnosis and earlier diagnosis strategies in Gaucher disease. And when I am thinking about that, I have some first questions. One of these questions is, what is the meaning of earlier? Another is if we have to focus on non-haematological perspective, that means that we have to know what is the prevalence of non-haematological symptoms in Gaucher disease. This is very difficult, but it's important to know what is the sensitivity and the specificity of these symptoms. And at the same time, we have to know if we could improve the nowadays algorithms. And in order to speak about the awareness, it's important to know which specialties can diagnose this disease and what awareness do these specialties have. Okay, when we are talking about early diagnosis, we are talking about the diagnosis before irreversible symptoms, and we are talking about the strategies in order to reduce the average time, because it is important to reduce this time from the first appearance of the symptoms of Gaucher disease and to final diagnosis. We want to talk about prenatal programs, nor mass screening programs. Okay, time to the first question. In your country, what is the main presenting feature of Gaucher disease in the time of diagnosis? Okay, so we have 82% from the public decided splenomegaly, 16% hepatomegaly, nobody bruising, bone pain only 2%, epistaxis and others 0%. Okay. We have a study published about the symptoms when the patients went to the doctor before the diagnosis. And we can see that the most important symptoms is the enlargement of the visceral enlargement. Mostly we can see that 90% of the patients have splenomegaly, but it's important to know that 50% of the patients have hepatomegaly, and the other most important symptom is the bleeding, okay? For example, bruising, epistaxis, and postoperative bleeding. But it's very important to know that the bone pain affects to 43% of these patients, and avascular necrosis is less common, but it's all important. About the size of the visceral, the visceral enlargement and the visceral symptoms in Gaucher disease, we can see in this slide that most of the patients have a moderate enlargement of the liver. 56% of the patients have a liver volume between 1.25 to 2.50 multiple of normal value. And at the same time, 50% of the patients have a huge splenomegaly. So the splenomegaly is more important in these patients than the liver volume. But it's very important to know that, surprisingly, 94 patients with Gaucher disease have some radiological bone disease. With this slide, I would show the principal radiological symptoms. For example, the 46% of the patients have Lemmeyer flash deformity, 42 osteopenia, 40 marrow infiltration with MRI, 24 infarction or avascular necrosis, 15% of the patient fracture, lytic lesions, or in 8% joint replacement. But, as I said before, 63% of the patients have bone pain. When we are talking about the symptoms, we have to know the etiology of these symptoms because, for example, osteopenia is very common. It's very common in the population. We have two kinds of osteopenia, osteoporosis. We have the primary and the secondary osteopenia. The primary is a kind of almost a physiological process when we get older. It starts when in women when they are over 50 years, and in men when we are over 70 years old. But there are another very common disorders that affects to the bone, and it can cause osteopenia. For example, endocrine disorders, diabetes mellitus, the hyperparathyroidism, the hyperthyroidism, the hypogonadism, digestive disorders, for example, the celiac disease, the Crohn's disease, the gastrectomy, hematological disorders, for example, multiple myeloma, lymphoma, hemolytic anemia, or systemic mastocytosis. And at the same time, connective disorder, for example, rheumatic arthritis or another, Ehlers-Danlos. But another drugs that we can use in the common practice, clinical practice, affects to the bone and they can cause osteopenia. For example, heparin and steroids. The nutrition is very important, the lack of calcium and the lack of vitamin D. And one other thing very important is the lack of physical exercise. About the etiology of avascular necrosis, there are common and uncommon causes. Among the common causes, we have, for example, the alcoholism, the traumas, the use of steroids, the inflammatory bowel disease, the lupus, the cancer, the septic shock, and the pregnancy. And uncommon causes, for example, we have the sickle cell anemia, the Gaucher disease, but we can forget, for example, the mucopolysaccharidosis and other metabolic disease. Okay, about the sensitivity and the specificity, the bone pain is not a word or is not an expression very accurate, and so the specificity is very extremely low. And at the same time, women over 50 years old, they can, in many times, some risk of bone fractures because of osteopenia, of osteoporosis. But I think that when we are thinking about the strategies, maybe we will have more specificity in younger patients. I think that we have more specificity of osteopenia, osteonecrosis, and avascular necrosis in younger patients. Okay? About the algorithms that we have nowadays, and in order to think about how can improve, It depends on the ethnic group, obviously. For example, with Ashkenazi, as you know, with splenomegaly, because of the frequency of Gaucher disease, if we compare with hematologic malignancies, when we have the splenomegaly, we have to do the test directly. But in other ethnic groups, when we have the splenomegaly, because different frequency of the Gaucher disease, if we compare with hematologic malignancies, in this group of ethnic people, we have to rule out the most important things that causes splenomegaly, for example, the portal hypertension and the malignancy, the hematological malignancy. But when we see these algorithms, if we think about the bone disease is very frequent in Gaucher disease, it seems like it's not important because it's here. It's not important. It seems that it's not important, but really it is. And I said before, bone pain is not accurate. It's not a correct word or expression or term. So for me, it's we have to change that, in my opinion. There are some published studies in the medical literature about how to identify the high risk of Gaucher disease in some populations. For example, we have here, but this is only the same, for example, in these two first articles about the main symptoms in Gaucher disease, the pathosplenomegaly. In this, for example, they try to calculate the sensitivity and the specificity when the ketone trioxidase was more than 4,000. In this article, they use the main symptoms in Gaucher disease, and they diagnosed 3 new patients. And in this, for example, there is another, maybe a new parameter of lab that they realized that more patients had a reduced level of cholesterol, HDL levels of cholesterol. Okay, so time to the second question. Patients who have no mild splenomegaly at presentation don't have Gaucher disease. True or false? Okay. False. Okay. So, for example, we have another published study that they realized that obviously there are Gaucher disease without a huge splenomegaly, and they can have no or mild splenomegaly. And yes, and going with the same articles about the risk populations, we have that, for example, in this article they use the same main symptoms in Gaucher disease. In this article, for example, they use the beta-2 microglobulin as a marker, and they realize that the level of this protein correlates with the disease and the severity of the disease and with the ketone trioxidase activity. Okay, another question. which specialist is most likely to diagnose early Gaucher disease in your country? Okay. Most of you tried hematologist, the second pediatrician, and the third place general physician internist. Okay. We have another article, for example, that they say that the most important specialty involved in the diagnosis is hematology, and in the second place, the gastropathology. I think that it depends of the country. I will explain why. But it's important to have some idea about that. But unfortunately, even though the awareness between the hematologists and oncologists is very poor, for example, the professor Timran said before, we have another article about which percentage of the hematologists and oncologists, physicians, included the Gaucher disease in the differential diagnosis of these symptoms: anemia, thrombocytopenia, hepatomegaly, splenomegaly, acute or chronic pain, the typical signs and symptoms of Gaucher disease, and only 20% of physicians did it. I said that it depends of the model, of the health system model, and I think that we will change in the future. I don't know in each country, but for example, the internists have become the reference figure of the units of inborn errors of metabolism, and at the same time, anemia is one of the most frequent afflictions in clinical practice among internists, mostly referred from general practitioners. But I think that when we are talking about the awareness, for this reason, if we know that the awareness among the hematologists is poor, imagine among the internists. So I think it's very, very, very poor among the internists, and I think that they can see many patients. And on the other hand, I think that for hematology, the Gaucher disease, I think that should be easier because sometimes they make the diagnosis before the bone marrow biopsy. Okay, so for this reason, my proposal, I think it's my opinion, that in order to start up different strategies, we have to increase the awareness among the internists, because they have the general view, and those who see the patients from primary care and who see patients in a general view, and they start in the bone. We have to increase the awareness among the radiologists, because we saw before that 94 patients have some radiological involvement. We have to promoting studies with the commitment of the radiologists, and we have to promoting studies with patients who have bone pathology, for example, osteopenia in younger patients, when, for example, they have anemia, or, for example, when they have avascular necrosis, for example, in hips with unknown origin. Okay, that's all. Thank you for your attention.